Hello, my name is Mohammed Wasim, and for my Teach 1 assignment, I'm doing Precision and Predictive Medicine. Today in our society, a lot of stuff is electronic. Uh, Things are moving towards electronic data and big data, and having records of health and having a lot of information about health really helps advance technology nowadays. Precision and protective medicine is one thing that can help advance health and technology both. Precision medicine, I'm gonna elaborate more in the upcoming slide, and also I'm gonna do the same thing with protective medicine. So hopefully I can teach you guys a little bit about each one. Precision medicine is a process of targeting each person's case individually, rather than just targeting the disease as a whole. Different people react to different diseases and medication differently. One thing might work for someone, but it might not work for someone else. So in precision medicine, they try to tackle, each person's case. So they try to gather as much data as they can from different people with, different body shapes, different height, different, similar reactions to certain medicine and stuff like that, and try to compile a big list of data so that they can cure each disease individually rather than curing the disease as a whole. An example of precision medicine I can give you is asthma. I'm sure each one of us knows someone that does have asthma, and each one of our friends or families that has asthma, different things trigger the asthma. It might be the type of environment they live in. It could be because of their habits. Some of them might smoke, and for some of them, inhalers might work, but for other ones, inhalers may not work. So this is just one example of precision medicine where one thing works for someone, but it will not work for someone else. So example of how does precision medicine work? The way that it works is the data is collected. Different people come in, they get tested for the disease that they might have, and they take their body weight, their height, their ethnicity, stuff like that, and they compile all that data. And it could be collected in many different ways. It could be collected through the doctors running a test, or people doing fitness tests, or blood work, or anything like that. And then people with the same symptoms that come in maybe a year later, have the same body measurements, maybe have the same ethnicity. They can come in and they can get treated for the same disease. And the plan is at the end that people with the same ethnicity, body shape and height, they can get cured the same way that the person that came in before them did. Now we're going to move on to predictive medicine. Predictive medicine uses genetics. Data is taken from people that have similar genetics, and they determine the probability of the disease to prevent future cases of the same disease or to remove the threat of the disease. One example is that is biomarkers, and that method helps them make a decision as to what disease someone might get or if it runs in their family, anything like that. So,
So,
what
what
are
are
biomarkers?
biomarkers?
Biomarkers are
Biomarkers are
biological
biological
measurements that
measurements
are
that are
used for
used for
many
many
different
different
purposes,
purposes,
which
which
include
include
identify
identify
people
people
that are
that are
high
higher
risk of
risk of
developing
developing
disease
disease
and
and
curing
curing
them
them
at an
at an
early
early
stage,
stage,
just so
just so
later on
later
in
on in
life
life it will
they'll be
they'll be
more
more
likely to
likely to
not
not
have the
have the
disease.
disease.
So, how are biomarkers used? Biomarkers are also can predict the risk of early detection of disease. There have been many case studies that have been done by biomarkers. These studies have genotype cases and controls in order to identify germline, but that put individuals at high risk for developing a specific disease. One example I can give you of that is, my mom had thyroid maybe about 10 to 15 years ago. And when I recently went to go get a physical check, they asked if any disease ran in my family. I said my mom had thyroid, so they had a thyroid check on me. So the health benefits are, to advance medicine further. The goal is to treat people and patients from disease earlier than later in progression. Like for example, the example I just gave you. The doctors wanted to see if I could have a disease like thyroid and cure it before, maybe it gets worse or we realize it later down the road. So that's one way that it's advancing health with big data. So now I'm going to talk about some pros and cons of precision medicine. As you can see on the left-hand side, the pros are, it'd be more accurate readings about diseases, and you can treat people faster with the same, body type, like I talked before, height and ethnicity. The cons would be, it would cost more per person. It would cost a lot of money to hold that data, and different cases. There could be 1,000 different cases of this type of disease, and it would just get really expensive. And who knows? Maybe some people can't afford it, or maybe our health system can't afford it. Now I'm gonna talk about some pros and cons for predictive medicine. Pros would be, to help people prevent different types of diseases completely at all, and we can also cure diseases early on. The cons is, it's not always accurate. For example, I just gave you, my mom had thyroid, but they did a test on me and I didn't have thyroid, thank God or thankfully. So, and the other thing is, there's not a big enough sample size to see if it would be utilized well across, data and health. Yeah, in conclusion, about learning about both these topics, about predictive and precision medicine, I believe that both of them can help, health in the future. As we're more moving towards the digital age, and everything's moving towards big data and collecting a lot of data. I feel like it might get cheaper as we go along down this road, and advance further in health. So it might be something that could be utilized a lot more in the upcoming future, and I feel like it's something that could help a lot of people in the future, cure a lot of diseases, help people live longer, and hopefully people can stay with their loved ones longer as well. Thank you for watching or listening and watching to my Teach One. Hope you guys learned as much as I did, and thank you very much.